We've been hearing quite a bit of talk this week about the different types of testing for COVID-19, specifically antibody testing. Channel 3's Kara Sundland spoke to a doctor at Hartford Hospital today about how it all works.
Would you like to know if possibly you were already exposed to the coronavirus? Antibody testing is ramping up, and I'm joined now by Dr. Eric Walsh. He is the medical director of Hartford Healthcare Go Health. Thank you so much for being with us, doctor.
Great to be with you.
You can go online. You can make an appointment. Basically, anyone who wants to right now can get this antibody test. Is that a good thing, and should people get it?
It's a good thing for a couple reasons. I think if you step back away from the virus itself for a second, one of the things that the medical literature, and I think all of us in society kind of recognizes, there's a lot of anxiety around this virus. This will give you some idea as to whether or not you may have already had it. It doesn't predict specifically whether or not you're immune. But obviously, if you have antibodies, it would suggest there might be some immunity, and we'll wait and see what the science says on that. But I think for a lot of people, it's the peace of mind. If they have no antibodies and they have a negative coronavirus test, they probably never had it and are probably still susceptible. So from that side, it helps. On the other side, if you have the antibodies and you had a positive test, you probably have some immunity and you had the disease. If you're someone of those people that fall in the middle, the best we can say is for all of us, you're going to have to keep doing social distancing, washing your hands, wearing your mask. There's nothing so far that would stop you from needing to stay safe and protected.
So let's say you're asymptomatic and you go get this test and it shows you have the antibodies. What does that really mean, and would it change your daily life as far as how we're supposed to be safe?
It would not change how you're supposed to be safe. What it would mean, though, is that you could have very likely had an asymptomatic case of this virus. And we know 25 to 50% of people who get it actually don't have any symptoms at all. And so you may be one of those people who had it and didn't get symptoms and developed antibodies, which, again, might mean, we'll learn more as the time goes on, might mean that you have some immunity.
And we don't really know that if you can get this virus a second time. I guess we're assuming that you might not get it as badly if it behaves like most viruses, but we don't really know if you might just get infected again.
You might get infected again. But to your point, if you ever got the chicken pox the second time after having it the first time, it would be very mild the second time. And so we would imagine, I mean, again, just based on what we know about even from SARS a couple of decades ago, that you would get some immunity. SARS gave like a year's worth of immunity if you had the SARS from back in 2002. And we would assume that this would give you some immunity. And that if you did get it again, you'd get it more mildly because you would have some antibodies to help you.
Thank you, Kara. And Dr. Walsh, if you'd like to learn more about antibody testing, you can watch an extended version of Kara's interview with Dr. Walsh on the Channel 3 app right now.